Welcome to the New York Professional Spotlight. Host Roman Kirzhner sits down with successful professionals from across New York to uncover the stories, strategies, and expertise behind their achievements.
Welcome to our podcast. Today's guest is Michelle Zweifler. She is respected professional in New York in medical field, and we will be discussing strategies, lessons, experience that have helped her to her success. All right, Michelle, thank you very much for showing up, and let's just start.
Thank you for having me.
Absolutely. All right. Now, the first question will be, can you give us a quick snapshot of your professional practice today?
Yes, I am a board-certified plastic surgeon. I practice in Manhattan on the Upper East Side, and I specialize in making you be the best you, whether it's a facelift and facial rejuvenation or a mommy makeover. I'm here for you, and I love what I do for a living.
Absolutely. All right. In this field, there's a lot of professionals doing the same plastic surgery, kind of medical treatment. Yeah, it is medical. And I would like to know.
Yes, it is medical.
It is medical. I just would like to ask you, what actually sets you apart from what comes natural to you, from whereas other people probably feel that they have challenges?
Well, like many of my colleagues, we completed residency, took written and oral examinations, and which credits us for being a board certified by the American Board of Plastic Surgery. What I believe differentiates me is my own personal story and what made me become a plastic surgeon. I actually had a rhinoplasty when I was in high school at Manhattan Ear and Throat Hospital, and I woke up from surgery and just thought it was the coolest thing, and I wanted to become a doctor and a plastic surgeon, and I want to help people. I want people to feel as good about themselves as I did after my procedure, so I could relate to my patients. I've experienced plastic surgery. I know what it's like to have maybe a body feature that it feels like it holds you back, and I want to restore your confidence and improve your self-esteem so you could be the best you possible.
Thank you.
I think that's what differentiates me.
Absolutely. I can feel the passion in that answer. Absolutely.
Thank
All right. And next one, if someone would like to become better and know what you do, what advice will you give to people that want to achieve the results?
I mean, besides completing the appropriate training, I also did a fellowship after my plastic surgery usual training in aesthetic surgery, specializing in facelifts and eyes in San Francisco. Everyone wants to look natural. So my first bit of advice is go to a reputable program, complete the training, do a fellowship in the area that you love in medicine. I go to many national meetings a year, listening to colleagues speak, bouncing questions off one another, watching videos. This is how we learn to be better. Going into the operating room and watching other surgeons operate. This is how you improve yourself. There's always new technology that you hear about, and there may be new injectables that you hear about. And with surgical technique, there's refinements. And sometimes you could be in lecture for 3 hours, and just 1 minute you hear something that changes your technique to make you even a better doctor than you are.
Thank you. Absolutely. You have more than 20 years of experience. You have a lot of things to share with people.
And don't date me. I don't want to.
No. It's just a compliment of experience. That's all. All right. And obviously, all this, that what you just saying is, it comes with plus and minuses, pros and challenges. What the biggest challenge that you can point out in your career?
Well, as a surgeon, there are challenges that, as a plastic surgeon, we want everyone to be happy afterwards. And some patients don't have realistic expectations. Despite spending time educating, people aren't always realistic what can be achieved with surgery. And then on the other side, unfortunately, we are human, and healing takes a lot of different variables to maximize that. But scarring and surgical complications are things that none of my colleagues or myself like. We want everything to go smoothly and really happy patients, but unfortunately there are risks to every procedure that are performed, and those complications need to be addressed. And that's one of the biggest challenges, is having complications where if someone's not completely satisfied. You want everyone's things to go smoothly, and you want everyone to be happy.
Thank you. Absolutely. Absolutely. Thank you, Doctor. Congratulations on the things that you're going with your career. That's exciting, obviously. From what I know, many doctors in your field basically doing really well right now financially. But if they will stop working, and the probably income will go down and probably will dried up. Some of them looking towards future, I mean, probably some kind of income besides the income that they receiving from work. Some of them looking to invest in stocks, bonds, cryptocurrency. Do you have any thoughts about creating income outside of the work?
Well, yes, you need some other source of income, because you're only working as an individual physician, and when you're there and working. So when I'm away on vacation, no, I'm not getting income in from being a private practice New York physician. Some of my colleagues have medical spas, so that generates revenue when you're not there, that you could work. And I have worked with estheticians over the years that could do ancillary procedures that don't require a board certified plastic surgeon to perform, that complement what we do as plastic surgeons. I'm working on a side project. I've been working on a book, so that is hopefully going to come out, not yet, but hopefully in the near dear future, and that could generate some revenue and even further growth and interest. And I have colleagues that invest in real estate and that are landlords and sublet and do various other options. And yes, we all know about the stock market and the good and the bad.
Absolutely. You're doing your book by yourself, or with help of AI? I guess. Yeah. So everyone is doing something in addition to their work, right? So you're working on your book. Congratulations, and hopefully it will be bestseller.
Thank you. That's always the goal. You always got to shoot high. You always got to go high.
Absolutely, absolutely, absolutely. If someone wants to connect with you, or learns about your career and your practice and your story, how they can do that? What channels you would recommend? How they can connect with you?
Well, part of me is still old school, so yes, I have a phone number. I could always be called at 212-355-0500. You could visit my website at www.drmichellezweifler.com, or you could follow me on Instagram, Dr. Michelle Zweifler. You can follow me on Facebook, LinkedIn. I'm even on TikTok, because some of my younger patients wanted me to get involved with that. And there's lots of different ways to come connect with me.
Thank you. Thank you very much. That was sweet and short and really to the point. Thank you very much for your time, and congratulations on everything that you achieved so far, and for the future books. Thank you.
Thank you so much. I really appreciate being here in this opportunity.
Thank you.
Thanks for listening to the New York Professional Spotlight. If you're a successful New York professional with insights to share, visit nyprofessionalspotlight.com/guest and apply to be featured on the show.